This is a killed bacteria, Lyophilized strep pyogenes, which is interesting. It's a little bit different than some of the other treatments, but mechanistically it's actually very similar to BCG. But the thinking is that it's a broader immune potentiator than BCG. So it can stimulate more groups of cytokines and it has potentially a broader impact across the local immune system, which may be important. One of the limitations or some of the concerns about immunotherapy is that you get immune exhaustion. You get a little bit of a exhausted immune system when you continue to stimulate the same components or the same cytokines over and over again. So there's a rationale that potentially by being a more broad immune potentiator, this may have elevated or better outcomes. I think what's cool about this trial is they included naive patients, BCG naive patients who had CIS. That's a group that is now being more frequently studied. A lot of the other trials and the other agents kind of started just in the unresponsive space. So they have a lot of data and a lot of patients in the naive space, which, as you said, is really important because we have BCG shortage issues. And we are concerned that maybe BCG is not going to be a long-term sustainable option for all patients with high-risk non-muscle invasive bladder cancer. So positioning itself in a trial setting with BCG naive patients is going to be important, and they've already read out some really good data in that group. Great question, and so the way I would summarize the results is that we see it's early. The follow-up does need to be extended. We need to look to see how these patients do down the road, and we need to evaluate more patients. But of the patients that we were able to evaluate, we have a really high response rate in the BCG unresponsive group. In fact, it was higher percentage-wise than in the BCG naive group, which is interesting. Usually that's flipped, but speaks to potentially this concept of immune potentiation, and that patients who have already seen BCG may do better because their pump's already been primed and you're potentiating or you're elaborating a better immune response on that group of patients. So I think that is one thing that I took home from this is that group, that BCG unresponsive group, which is typically a very difficult group to treat and has a high incidence of recurrence, has a really good complete response rate, anytime CR rate at 6 months. Future studies I think are going to be important, and then also this concept of immune priming. They are interested in looking at subcutaneous priming with TARA-002, followed by intravesical instillation to see if that combination effect may have an augmented response. But overall, I think this is novel, both in its mechanism of action and how it potentially can be used or placed within the space of high-risk non-muscle invasive bladder cancer. So the future will tell, but so far the signal and the efficacy that we've seen in a short period of time is very encouraging.